equally concerned, and similar situation where we haven't really curtailed opening, and we're going to continue opening based on our governor's projections. What happened for us is that we reopened without really good, clear, consistent messaging and without really emphasizing how important it is to follow the social guidelines, the distancing, the mask wearing, the not congregating and not socializing in the way that it happened. So much like Texas, we also suffered some of this resurgence. My hospital system recently announced that some of their increases in hospitalization wasn't so much that the patients had COVID, but they were on for other reasons. They were admitted for other reasons and also detected COVID. But that doesn't still leave the basic dangers that we see, because we have a large vulnerable population here and frontline workers, essential workers who are at very high risk. So it is very concerning what has happened.
You're seeing a lot of cases as well in younger people. From what I understand, statewide, ages 15 to 34 now make up more than 1/3 of all of the cases in the state.
Exactly. And we know it's because the messaging that came out is that despite COVID being there, it was really the elderly that would be the issue. And most people are asymptomatic and the young will be okay. And I think that messaging was accepted readily by our young people, which left them very vulnerable for infection and for not doing the activities that are really essential. And also the modeling of that behavior wasn't really consistent throughout the state. So many times if you're watching television, the modeling in whether it's law enforcement, leadership, did not demonstrate the importance of mask wearing and distancing. So there is a lot of concern that as we continue to open, how are we going to get this message across? And how are we going to have acceptance that this is a dangerous infection that we don't know anything about significantly? What could happen to your future? Like I tell my patients, HPV was asymptomatic. And look what happens 10, 20, 30 years down the line. So unless we have better messaging and better guidelines, really strict guidelines saying indoors wear a mask and businesses adhere to this, we're not going to see any downturn in this surge.
It's interesting that you're talking about messaging. There is so much misinformation out there in terms of the numbers going up. Some say simply because there's just more testing, so you're going to find more cases, whereas the positivity rate is alarming in Miami-Dade County. We're talking 27% positivity rate, what I saw today in Miami-Dade. That says widespread transmission of the virus.
Exactly. That's what we see. And as physicians, we are incredibly concerned. And we also would like to have real stronger messaging, consistent messaging. The Surgeon General made it on the weekend saying recommended, but it wasn't said in a way in our media that the young people are going to see. We have a very diverse population in Miami. We have Haitians, Jamaicans, different variety of Hispanic. That means that their contact and their media, it's not going to be just traditional media. What are the steps that we're taking to reach out to our population to get the message across? These are some of our concerns, that it's whether you enforce a law or you make it mandatory, unless you can message it and transmit that message effectively, it's not going to be heard. So we really know that at this point, we've got to flatten the curve and immediately. And that's going to take messaging, modeling, and tracking and tracing everyone and containing the infection as rapidly as possible. So we need good data, strong data, knowing where are the hotspots, who's getting infected, how can we get to all their contacts immediately and contain it? And if there are issues that we know, we're poorer communities. Most of our poor communities live in multi-generational homes. They are out on the front line working. I have a friend in Palm Beach who told me that many of the people he saw in his ER were landscapers and workers. They weren't all the young kids playing. So it's not just kids in bars. It's also people who are working everyday jobs who we're seeing showing up with this infection.